Hey everybody, my name's Adam-Jon and I'm a mental health therapist and I identify as a Latino queer man, and this is QMOC Talk, a simple conversation about mental health concerns, well-being and wellness for queer men of color and folks who care about them. Today we're going to have a real fun conversation with Dr. Daniel, who's going to talk to us a little bit about the monkeypox virus, where we're at with it, what had happened with all of that, just so we can have a quick debrief of the happenings of the summer of 2022. Just a couple of things before we get started. So myself, as well as Dr. Daniel, we're speaking for ourselves, both for me, a mental health therapist, and a queer man of color, and for Daniel as well as a queer man of color and a doctor in community, and we're speaking for ourselves in general. The other thing is that it's important to know that we're in the first couple weeks of October 2022, and so if you're viewing this at another time, just know that things most likely have changed with the monkeypox virus, and so just make sure to check out the CDC website for the latest on what's going on with that. So without further ado, Dr. Daniel, do you want to introduce yourself, share a little bit about your identity, what you do in the world, and anything that would be helpful for folks to know about you?
Yeah, thanks for inviting me. My name is Daniel. I'm a family doctor and I work in community health. I use he, him pronouns and I identify as a gay man. I'm also Latino, Chicano. So my parents immigrated from Mexico. Yeah.
Yeah, awesome. Well, thanks again for being here. And Dr. Daniel and I have known each other for a long time, and I've always thought that being able to do something professional with you to show other folks just how awesome you are, and share you with other folks is so important, because I don't know about y'all, but I don't often get to see queer men of color as doctors, and so I'm just super thankful to have you here. So the first question overall is, what is monkeypox in general, and why did it come back? And I don't know, like RuPaul says, like she already had hers. Like, what happened? What had happened?
Yeah. So monkeypox is a virus. It is related to smallpox, and it is actually not related to chickenpox. It is endemic to West Africa. Meaning that there have been cases in West Africa for 60 years, I think. We've had small outbreaks outside of West Africa, but this is the first kind of worldwide outbreak. And as with any infection virus, the circumstances were just right for people to transmit the virus in a way that it spread to almost all the countries around the world.
Yeah, I mean, it kind of coming off the heels of COVID-19 and kind of the isolation that came with that. I feel like this last summer, it just put so many of us in like go mode, right? Like, oh my gosh, there's this new virus and we have to kind of attend to learning more about it and kind of understanding what it even is. And so I guess for you as a queer man of color, but also as a doctor, how has monkeypox, or MPV as they call it, how are queer men of color being affected by MPV?
Yeah, good question. So as may or may not know, the vast majority of people with monkeypox who have been infected by monkeypox during this current outbreak have been gay men or men who have sex with men. And then that it has also been disproportionately being affected men of color. So Latinos, Black people, Natives have a higher rate of infection than their white counterparts.
Yeah.
So that's been really scary. And as a gay man and also a person of color, clearly the relation to disproportionate healthcare outcomes is, we see that across the board. We see that with HIV, we see that with, chronic illness. and a lot of it has to do with access to healthcare, and that's primarily a big problem, and
Yeah.
systemic racism.
Yeah.
So, the medical community, it's just like, what now, right? Especially after, coming down from the COVID pandemic. So it was really scary at the beginning. We really didn't know what was going to happen. We didn't know what it was going to look like. Fortunately, this strain, or this version of the monkeypox, has actually been, in general, less severe than what we have seen in other places.
Mm.
That doesn't mean there have been definitely severe cases, and including a few deaths, but it seems like a lot of the people who have gotten it during this kind of outbreak haven't been as severe as we have seen in the past.
Yeah. Well, that's good to know. Were there any deaths in the US?
Yeah, there have been there's one confirmed for sure death in Texas, I think. And there are two more that I think are being investigated, like if they're people who died who also had monkeypox, and I think there's an investigation of whether or not those are it was because of the monkeypox, or it was just a coincidence.
Yeah. Okay. It's definitely like that's a very small number, probably, in terms of our population, but it's still kind of just scary that somebody passed away because of this virus. Which kind of leads me to my next question: is how did the outbreak impact life for the medical community, or even yourself as a doctor, and as well as a gay man? I think the professional as well as the personal person.
Yeah, so I work in community health and primary care, and as a gay man, I was seeing all these monkeypox articles, and it wasn't being talked about in my community, and so I personally took it upon myself to kind of start sending out weekly like info sheets, basically by email, to all my colleagues. And what is monkeypox, what to look for, how do you test for it, and I was doing all the research for it. So like minority tax, right? So that was extra work that wasn't being paid for,
because nobody was directing you to do that, right?
No. But it needed to be done, and eventually then the organization saw what I was doing, and kind of put me in charge of monkeypox. But
like, you over there, you're brown and gay, you do this. Oh, yeah.
And so so that was extra work, and it was scary because we didn't really know, we didn't have testing yet, right? Like, that was the other thing. And then testing came, and then at first it was only being done in the health department, and then finally commercial labs, at least in my region, were doing testing, and then trying to figure that out and navigate that, and then the whole vaccination rollout, which was different based on where you live in the country, but that was a whole ordeal as well.
Yeah.
So personally, in my personal life, there was a period of time where people just weren't going out for a while. Like, we were concerned about ourselves, and I think that was something that was just, people were scared.
Yeah, definitely. You had shared with me that getting the vaccine was pretty difficult. Do you want to share how you went about that, even as a doctor?
Yeah, so just a little bit of context. So the US has a national strategic stockpile of a vaccine for smallpox and monkeypox, and that was for in case of bioterrorism warfare. If there was a biological weapon based on smallpox,
Right.
So we had that somewhere, and it just took a while for it to get disseminated to the community. And so I think it started in big vaccination drives on the East Coast, and then it kind of came out through the rest of the country. But where I live, it didn't come here for a while, for several weeks after it started getting disseminated in other parts of the country. And so a lot of people in my community and the gay community were driving up to Vancouver, Canada, to get their vaccine because it was really easy to get it there. And that's crazy, I think, right? It's insane. And like clearly that's a huge barrier. Like how many people are able to take a day off of work to drive up to a different country, spend a day there, you know, and then come back, you know, to get the vaccine. And so, you know, people with fewer resources obviously weren't able to do that.
Yeah.
Fortunately, the vaccine came to our county through our public health department. And, you know, at that time, still people were lining up. There were 300 people in line every day. And, you know, people were waiting hours. And, you know, it was just really scary. I think we were scared, right?
Yeah. Yeah.
We also have now the vaccine in our clinic, which has been really great.
Awesome.
Mm-hmm.
Yeah. Even thinking about kind of where I live in Chicago. I just moved here a couple months ago. And yeah, the lines were super long. It was very confusing. I was giving a lot of like compassion to the public health people who are organizing it, and the like bars who like, they're like, we just are given this many vaccines and like, we don't know what we're doing. I got like a copy of like where to go, and it looked like, I don't know, it was a copy from the like early 90s. And it was a hot mess. Standing in line and being told like, oh, you should have been here 5 hours ago. That's when we were giving out tickets. And, you know, so it was a lot of in the know stuff. And yeah, it was just real all over the place. And again, to hear you say, I didn't actually know that we had that small stockpile because of biowarfare needs. Like, what?
Yeah.
The other thing for me that it brought up, both as a mental health therapist, but also just a queer man of color living in, you know, 2022, is that seeing the lines of gay men, queer men, it reminded me of what it must have been like, the confusion and a little like hysteria maybe, but rightfully so, of the AIDS epidemic, and kind of people sharing information and sharing it with who you know. And being a new person in Chicago, I'm like, I don't have anybody to turn to. So I was looking at all these different websites, and I was really panicking in a way, like, where am I going to find this thing? And what it seemed real frustrating and similar to the AIDS epidemic is my sister, I love her. She does identify as queer, but you know, is married to a man and lives most of her life with people not really knowing her sexuality. But it was like we lived in two different worlds. She was visiting here, and I'm like standing in line for hours, and she's kind of walking off doing her thing and has no idea kind of the anxiety that I'm feeling and the wonder. And she's just kind of living in this life like nothing's happening. And to me, it was like COVID all over again. It was like, you know, the AIDS epidemic. And, you know, again, I didn't live through it as I was a kid, but I imagine like what it must have been like for those folks back then.
Yeah, certainly. You know, there was a lot of conversation about, you know, the memory of the AIDS epidemic and, you know, the perceived like inaction of the government from what was happening and what wasn't happening, and the stigma associated with, you know, another disease, you know, people labeling it as a gay disease, right?
Right.
So, that's also been really hard, where, you know, our messaging and our outreach has been to mostly for gay people, right? Gay men. And how do you balance that with like trying not to stigmatize it at the same time, right? So
Right.
it's, you know, it's a balance.
Yeah.
Anyone can get monkeypox, right? It's, you know, it happens from prolonged skin to skin contact. primarily, and a few other ways as well. But
Mhm.
anybody of any age, of any gender, of any sexual orientation can get it. And so sometimes that can also not provide cause some people to feel safe when maybe they're not, because well, I'm not a gay person. This doesn't apply to me. They're not informed. They don't know. You know, so
Yeah.
it's kind of a dangerous thing. The stigma around it.
Yeah. Yeah, and I think we're, you know, in this kind of aftermath, but it's also still going on. So what is the current status of monkeypox virus outbreak? And yeah, what in this early October 2022?
Yeah. So this outbreak started in May, early May, and I think the first cases were seen in England, and then very shortly after, cases were seen in Boston. That was the first case in the U.S. Still in May, and the peak of this outbreak was early August. And so since early August, it has been slowly but steadily decreasing the number of cases. So that probably has a lot to do with the vaccinations, people changing their behaviors during this time temporarily, and so right now the CDC says that they are cautiously optimistic for the way
Mhm.
it's trending, which is a good sign. Um, but we're not out of it yet, so we don't know what's going to happen in a couple weeks or in a couple months, if it's still going to be here, if there's going to be a second wave, or if it's going to spread to other communities. But right now, hopefully, it will continue the current trend, and hopefully to go away.
Yeah, cautiously optimistic. It sounds like me in every relationship I enter. Okay, so we're kind of like CDC is like, okay, like we're doing our
Mhm.
thing. We hope that it goes well, and we think that it might go well. But so does that mean that people should still get vaccinated right now? And are there any risks to getting the vaccine?
Yeah, for sure. If you are eligible, you should. I still recommend you get vaccinated. And the best protection for ourselves is also to protect our community, right? The people we're around, and so getting your friends, your community members vaccinated as well, is going to be really important. So I say yes. The U.S. Authorized a different route of administration in early August to stretch the supply, and theoretically has the same effectiveness. Um, and so now there's a bigger supply.
Okay.
Um, some health departments are starting to kind of loosen the restriction or the eligibility criteria a little bit. So, if you didn't qualify before, check again and see if you qualify now. Uh,
Yeah.
and that's being done basically like region by region. So what's happening here where I am might be different from what's happening where you are.
Okay.
The risks. So far there hasn't been a lot of like bad effects from the vaccine, from the Jynneos vaccine, which is the one that's being pushed right now. There's two vaccines. The other one, the ACAM 2000, is not really being used because that one does have a lot of side effects.
Mhm.
But the Jynneos one, which is the one that's being pushed right now, is relatively safe. There's not a lot of bad effects. People who are pregnant can get it. Um,
Okay.
People who have HIV can get it. And so, as far as we know, right? So
Okay.
it doesn't have huge study of populations, but it has. The biggest thing right now people are experiencing is redness and itchiness and swelling at the injection site.
Okay.
And so that usually lasts a few days, and then goes away. Some people have gotten little kind of like nodules or bumps that last longer in the place where it was injected, but that has been not common.
Okay, awesome. So if I'm double vaccinated, but I wonder if I wanted to get the vaccine, one, do I have to pay for it? And then two, do I just like ask my doctor like, yo, can I have a shot? Like, how does that work?
Yeah, I mean, it depends on your region. Generally, the vaccine itself is being provided for free because it's coming from the government, directly from the government, right? Some places may charge an administration fee, and for the act of actually injecting it, people have to get paid for that, right? So that shouldn't be too expensive. A lot of places are not charging that, but some places are. So, or billing your insurance for it. And what was the second question?
Yeah, do I just ask my doctor, or can I
yeah.
go to my doctor's office and say, can I just get a shot?
Yeah. So that's a good place to start. It is possible that your doctor's office may not have the vaccines themselves. And it is also possible that your doctor may not know because they don't have a lot of, LGBTQ patients that this applies to, and so they just don't know. So if they don't know, the other really good resource is your local health department, and those are usually the most accurate kind of places where tell you where you can get the vaccines. Okay. There's been also, I've heard a lot of community drives as well, like you said, at the gay bars, at the bathhouses, to kind of reach people where they're at already. And those have been pretty successful as well.
Okay. Yeah, and I would say just ask around. Like if you're, that's honestly how I found out. I started to ask around online, and I was new in a community, and I also met a friend in line while waiting for my vaccine. I was like, I'm going to talk to the person instead of looking at my phone. And so definitely, we need to, I think, band together as a community to help each other out. And it's so important. Before we wrap up, anything else you want to add to talk to other queer men of color or folks who care about them?
Yeah, I mean, we have to stick together, right? I think it's really important to have community, and some of us are in spaces where we're the minority, or we're the only queer person, or we're the only person of color, or we're the only queer person of color, which is my case. And so that is finding other people who are like you is going to be really important. And it's great that other professionals, healthcare professionals and medical and mental health professionals, like we're all in it, and we're all facing it. So find your community, find people like support each other, especially through these kind of crazy times where things can get scary.
Yeah, awesome. Well, Dr. Daniel, thank you so much for coming on and just chatting about this really important topic. Again, this is QMOC Talk. It's a space where we talk about different things around mental health, wellness, and overall well-being. Again, thank you, Dr. Daniel, so much. And if this is a video that you all enjoy, let us know, and maybe we'll do another. Bye.
Thanks.